next topic of forensic medicine, traumatology. And this is also called mechanical injury because there are certain mechanics involved in the production of wound. And the contents of the today's talk will be that we'll be discussing various definitions and other legal terms which are synonymous with the wounds and the injuries. And finally, the terms which are used in the present law, which is prevalent in the Qisas and Diyat law. And how we classify various traumas and the medical legal classification, which is for which we are concerned, the medical legal classification. And then the hurts, the term hurt is used in Qisas and Diyat law, and how we classify hurt in Qisas and Diyat law. Then we'll discuss what is the mechanism of wound production and how the wounds are produced, because there are certain components of trauma which should be fulfilled for the production of wounds. Trauma, basically, it is the physical or structural damage. Physical or structural damage by the application of physical force or some energy. So it is the physical or structural damage to the human body by the application of physical force, energy, and it is simply the study of injuries. When we say traumatology, it's basically a science which deals with the study of physical and structural damage to the human body by the application of physical force, physical energy, and that is traumatology, and we'll try to learn that. And that's why it is called as mechanical injury, because there are certain mechanics involved in every wound production. There are certain terms which we should understand: injury, wound, hurt. Apparently they appear the same. Injury, we understand this is the discontinuity in the structure or architectural design of the body, of the organ, internally as well as externally. And this is injury. Similarly, the wound in medical terms, that is also the breach in the integrity. So both the terms, the injuries and the wound, having the same medical meaning, whereas the law defines in a different way. The Pakistan Penal Code, PPC, it defines injury as any harm caused illegally to another person, to his body, mind, repute and property. So it not only includes the physical damage to the body, but also the mental sufferings, his reputation and any damage to his property. So PPC defines injury in a different way, in a broader way. Now this PPC has been replaced under hurt in Qisas and Diyat law, because both the laws are prevalent, but in hurts or in injuries, basically we follow the Qisas and Diyat law, and it defines under hurt. Hurt defines injury according to the amount of damage. It also defines the punishment and the monetary compensation, whereas in PPC, injuries are defined under other sections, the punishment, they are defined under different sections. But here, under the same section of hurt, they are all classified under amount of damage, the compensation in the monetary benefits, and the punishment to the culprit. So the hurt has a broader term than the PPC. It gives a more elaborate information about the injury. It defines according to the layers of the body, skin deep, muscle deep, bone deep. So it defines, when we study in detail the hurt, the qisas and the law, we come to understand that this is more elaborate and better understanding of the physical damage. And it gives the compensation. The qisas is khoon baha, khoon ke badle khoon, and diyat is the monetary compensation. So this law has defined compensation for each part of the body as a whole, body one organ, two organs. So complete description of the amount of compensation has been defined. And also the punishment, because this is qisas, badla, khoon ka badla khoon, organ for organ, life for life. So that's how the punishment is decided in qisas and Indian law. So legal definition we should better understand because they are comprehensive, they are elaborate, they are concise, and we must understand, because sometimes the law takes some injury as a minor injury or not as grievous as the law understands. For example, the most important example is bruise. Bruise is a simple injury. Application of blunt force, there is a rupture of the vessels and the collection of the blood under the skin and the muscle, that is bruise. But when the area involved of the body is more than 25% and it is deep, that means enormous extravasated blood must have been collected, which will be sufficient to cause shock or any other complication. So in the eyes of law, the bruise appears as a simple injury, but it depends upon the amount of damage, the area involved, and the depth involved. So the fatal results depend upon the amount of damage. So that's how we determine according to. Previously, the Pakistan Penal Code, there are two sections, 319 and 320, two sections. 320 was basically for the grievous term. This is another term, grievous hurt. That means the hurts which are called as dangerous or grievous, they were under section 320, and 319 describe the normal hurts, normal injuries. Now these two sections, 319 and 320 of PPC, they are replaced by 320 of Qisas and the ordinance. They comes under same act. All the injuries, the damage, the compensation, the punishment, they are all under one section, 320. Previously, which I used the term grievous hurts, you can judge that for all grievous hurts, the injury were different, but the amount of punishment was same. For example, the grievous hurts, emasculation, removal of the testes, loss of eye, loss of ear, permanent impairment of any joint, permanent disfigurement, fracture of tooth. Now you can see fracture of one tooth. How can they be equal? But they were equal under one section as grievous hurt and the amount of punishment was the same. Similarly, any hurt which endangers life or which impairs the person's normal pursuit for 21 days, they were under grievous hurts. Now, hurt in Qisas-e-Diyat ordinance. According to Qisas-e-Diyat ordinance, the hurt means any pain, harm, disease, infirmity, injury, impairing, disabling, dismemberment of any organ. You can see how much amount of damage it covers, from pain, harm, disease, injury, infirmity, impairing, disabling, dismembering any organ or part of it, it comes under hurt without causing death, because when the death will occur, it will come under qatl, that is qisas. So without causing death, whosoever causes pain, harm, disease, injury, infirmity, impairment, disabling or dismemberment, so they cover all types of suffering to the human body. They are under hurt. Now, how we classify various injuries? There are many ways. We'll just go through, but for most important is the medical legal classification. Like anatomical classification, it can be closed wound, open wound, or burns. Burns are classed as different, and this is the structural appearance. Closed, they may be abrasions and contusion of the bruises, and the open wound can be lacerated, incised, penetrating, stab or punctured, firearm injuries, blast injuries. They are all open wounds. Similarly, the burns, there are many causative agents for the burns: dry flame burn, wet burns, sunburns, corrosives, electrical burns, lightning, X-rays or radiation burns. So all causative agents, they are responsible in causing burns. Then regarding the medical legal classification, we say as mechanical injuries, because certain mechanics are involved: thermal injuries, variation of temperature, extreme heat, extreme cold, they will cause structural damage to the body. Similarly, the chemical burn, all the corrosive and other chemicals, they come under chemical burn, and electrical burn. So that's how the medical legal classification comes. Then on the manner of infliction, that means it is either suicidal, homicidal, accidental, or self-inflicted. Note of it. Suicidal, homicidal, accidental, or self-defense. So this is upon the manner of infliction. So injury in legal, they come under hurt in Qisas-e-Diyat ordinance, manner of infliction, homicidal, suicidal, accidental, or self-defense. And upon positive agent, they are sharp edge, blunt weapon, firearms, or fire injuries. So these are upon the causative agents. Electrical burns, chemical burn, radiation burn, so these are all causative agents. So the medical legal, they can be mechanical injuries. We'll just go through single causative agent: blood, abrasion, bruise, and laceration. And by the sharp edge, they will be either the incised or the stab. And multiple causative factor, they are the blast injury, the firearm. The firearm can be smooth bore or rifled weapon. When it is rifled, then it is low velocity, high velocity, then high velocity is long barrel, short barrel. So these different types of weapons will impart their mechanics differently. The injuries will be appearing differently depending upon the type of weapon involved. These are other wounds, we have gone through them. Now, what is injury in PPC? Anyone? Any harm to a person, body, mind, repute, and property. So this is injury in PPC. Any harm caused illegally to a person's body, mind, repute, and property. Now, what is hurt in qisas in the authorities? Whosoever causes pain, harm, disease, injury, infirmity, disabling, dismemberment, so all these sufferings, they come under hurt. Pain, harm, disease, infirmity, injury, impairing, disabling, dismembering any organ or part of it is hurt without causing death. Now, the mechanism of wound production. And there are certain components of trauma which are responsible in the mechanism of wound production. And there are three basic components. Weapon, the tissue, and the force and the movement, the contact. Weapon, tissue, and subject, these all three should be fulfilled. Because if two things are there, weapon is there, the subject is in front, tissue is in front, but there is no movement or there is no application of force, the trauma will not occur. So lacking any one of these factors will not cause injury or trauma. So these are basic three components which are responsible in the causation of trauma, and any variation in one of these components will change the appearance of wound, because the weapon can be variable. The long list, anything can become a weapon. Similarly, the tissues, the site, soft tissue, hard tissue, bone, muscles, so all variation can change the appearance of the wound. Similarly, the amount of force, the movement, right angle, tangential, circumferential, heavy weight, light weight. So all these factors in the force and the movement will change the appearance of wound. So these three factors, force, tissues, weapon, they are responsible in the causation of wound production, and these are the same factors which are responsible in change in appearance, amount of damage. They are the most important factors. They change the appearance of the wound. The weapon, the tissue, and the force and the movement. So any one of these factors missing will not be responsible for causation of wound. Now about the weapon. Every weapon has got its intrinsic qualities. It can be broad surface, it can be pointed, it can be edged, it can be rough, it can be smooth, rounded. So there are a lot of variations in the shape and the weight. They change the characteristics. So there are certain intrinsic characteristics within the weapon which are responsible for variation of the wound production. So these intrinsic qualities change the appearance, and amount of force which is dissipated that will change. Similarly, velocity and the movement. Velocity has got an enormous role in firearms. A small mass, small bullet, instead of a brick having enormous mass, but this small bullet, because of its velocity, produces enormous damage. So when we talk about the intrinsic qualities of a weapon within the object, the characteristics, they may be small weight or heavy weight, size may be variable, then the surface may be rough or smooth, its shape, variation in shape, the margins, the angles, the sharpness, the rough. No talking. आपके साथ. So you can see that the intrinsic characteristics within the object, they are variable, and that's how they will produce variation in the wound production. And these intrinsic characteristics make a weapon either a blunt weapon or a sharp edge weapon or a firearm. The blunt weapon yes, there is one exception. We are talking about that three components: the subject, object, and the amount of force. And all should be there. That means the physical contact of the object with the subject with movement is responsible for the causation of trauma. But there is one exception, blast injury. There is no direct contact of the weapon with the subject. There is no direct contact, but there is enormous damage, and that is because of the shock waves. There is no contact between the subject and the object, but that is causing enormous damage because of the pressure waves, because of the shock waves which are traveling circumferentially from the site of the blast all around, and they are so forceful, they penetrate through the body, they travel through the body. तो हमने सी देखी हुई ऑटोप्सी करते हुए the body was intact, outside आपको body लगती है बिल्कुल intact है, अंदर body खोले तो अंदर हलवा बना, every organ was shattered. So they have got so much energy, they travel within the body, and this is the one exception, that there is no physical contact of the subject with the object, and even then the trauma occurs. Now the blunt weapon, this may be a brick, a stone, a metallic rod, or a wooden rod, or anything. They are the blunt weapons. And blunt weapon, the area of impact is wider. This is an example, and you can see that the area of impact is wider. So the per unit area dissipated energy will be less. The amount of energy dissipated in a broader surface to the tissue will be less, because the broader surface is in contact. That's how the blunt weapon, by the application to a broader surface of the body, produces less damage than the object which is concentrating on a single point or on a single edge. So the energy transferred in blunt weapons is on a broader surface, and the per unit area energy shifted will be transferred will be much less. So the wound produced by the blunt weapons will be either lacerated wound. When there is underneath wound, the tissues will split apart, and that is the laceration of the wound. or it will be a bruise. There will be crushing of the subcutaneous vessels, extravasated blood out of the vessel, and that is bruise. And the abrasion, this is the most superficial damage to the epithelium, that is the abrasion. So how they appear, this is the simple abrasion, damage to the most superficial layers of the skin, and this is a bruise, the extravasated blood subcutaneously, and that appears as bruise. And this is a lacerated wound. And lacerated wound is usually at a site there is underneath bone, and when hard object strikes underneath bone, it gets splitting apart of the tissues, and that is the lacerated wound. Then the sharp edge. You can see the sharp edge weapon. There is either the tip or the edge. When there will be application of the tip, it will cause stab wound. And when there will be application of the edge, it will cause incised wound. So stab and incise. So this is either the edge or the point. In the sharp edge weapon, basically it is either the tip or the edge of the weapon. When they are applied, they can produce either the stab wound or incise wound. So the extreme concentration will be either on the tip. When the weapon is being thrusted into the body, the whole energy is transferred on the tip, and it will cause a stab wound. And when it is dragged on the surface, it will produce a longitudinal wound. The stab wound, the depth is more, whereas in incised wound, the length will be more than the depth. So how the energy is transferred, either it is on the tip or on the edge in the sharp edge weapon. So in the stab wound, the tip is thrusted into the body, and the whole energy is on the tip of the weapon. Whereas in the incised wound, the edge is dragged on the body surface, and it will cause cleavage of the tissues, clean cut cleavage, and that is the incised wound. And they are more in length than the depth. Now the next is the firearm. You can see the smoke, you can see the flame, and these are all the wounding elements. And depending upon the range, the distance from the body, all these characteristics will be imparting damage to the human body. So, what is important in firearm? The bullets, they are traveling at a very high velocity, and this small amount of mass, ये एक बड़ी bullet है, just to see, show you, whereas the bullets are very small, rifle and pistols, and there are, but this is the bullet in a head. ये पीछे उसका shell होता है, इसमें gun powder होता है. The front portion is the bullet which travels, and this small amount, instead of the larger broad surface blunt weapon, this small metallic piece produces enormous damage because of its velocity, because the energy is directly proportional to half the mass and square root of the velocity. So this small amount of mass, because of its velocity, produces enormous damage. So the extreme concentration of the force will be at the tip of the bullet when it is entered, and this produces a very special wound. There is an entry wound from the where the bullet is entering. There is an exit wound where it exits from the body, and there is an intervening track from entry to the exit. There is intervening passage. The tissues, the organ which they are damaging through its travel within the body. So this is called as a special trauma. Firearm is a special trauma because it includes the whole traumatology. Every type of injury which we will discuss later on, they will be present there in firearms because it includes burns, blackening, tattooing, abrasions, land damage within the tract, laceration of the organs. So you can see all types of injuries, they are present in firearms. That's why they are classed as a special trauma. Thank you very much. That's all.